Hi guys, it's Jessica McGuire coming to you from White Rock today. I'm going to be talking to you about some supplements that can help with arthritic inflammation in the joints. I got a request from the daughter of my babysitter, who's quite near and dear to me. She was one of the most special caregivers that I had growing up, and I really appreciated her. So I want to say, if you're watching this, Maria, ciao, ti voglio tanto bene e spero di vederti presto. E voglio aiutarti con queste cose qui. Okay, so there's three things I want to talk to you about. The first is actually, the first two are a combination of turmeric with, or the active ingredient is curcumin of turmeric, and boswellia, the boswellic acids in boswellia. Boswellia is more commonly known as frankincense. So from the frankincense tree, there was also the frankincense golden myrrh that was given to Jesus by the three kings, and serrapeptase, which is an enzyme that breaks down fibric startups in the joints. So the first thing I want to talk to you about is what people normally use for pain when they have arthritis. Very commonly is Tylenol or acetaminophen. The problem with Tylenol, and they've done a study that 51% of people don't actually know the side effects of Tylenol or that it has any. But they've done studies, there's 74 studies, so there's a meta-analysis on Tylenol that it, there's still bees around? Anyways, that it actually causes acute liver failure. So this was an analysis of 74 combined studies containing 59,000 patients. So it's pretty conclusive, hey? And acute liver failure means that your liver stops working, and that's a really important organ, actually more important than you'd say maybe even your kidneys, because you got two of them but only one liver. And the liver holds on to fats and also processes toxins out of your body, so you really need it, especially if you want to have a glass of wine with your food. When you combine turmeric with boswellia, both of them, they help the chondrocytes in your joints, so from degrading. So those are the things in your joints that basically have that are your cartilage in your joints, and these are actually protective. And there have been a couple studies comparing the combination of turmeric and boswellia together, and the reason they put them together is because they affect different DNA pathways in the body. So there's three pathways. There's the COX-1, COX-2, which affect the aggregation of platelets, and also affecting joints, and boswellia affects also joints, but also asthma and COPD and those sort of things. And when these pathways get out of alignment, let's say one is more active than another, then it causes issues in the body, and you get autoimmune disorders. So the reason you put them together is because the curcumin in turmeric affects two of those pathways, and then the boswellia affects another. So together they formulate a team. It's a team effort. There was a study on Celebrex for 12 weeks, I believe, comparing Celebrex to turmeric and curcumin together, and the turmeric and curcumin actually outperformed them. And reported symptoms were, I think it's about 60 or 70% improvement on the arthritis with the herbs versus 29% only with the Celebrex. You guys can Google that. Also, I encourage you to look up your own studies on pubmed.gov, because that is public information. It's not only available to doctors, you're able to look up these studies for yourself. Then the other one, there's another study on Voltaren and comparing Voltaren with turmeric for the joints. And Voltaren versus curcumin was studied for only 8 weeks. and there were 3 groups. So there was one control group of just the curcumin, another one with both the curcumin and the Voltaren, and then there was one with only the Voltaren. Now the curcumin performed the best. Second was the combination, and actually the turmeric had protective effects on the drugs. And then the last was the Voltaren, and actually many of the people dropped out of the study because they had severe incidences where they could not continue. That meant they either had to go to the hospital or an ambulance was called, and they decided, yeah, that's not worth the study, so they dropped out of the study. Then last but not least, so on boswellia and turmeric, I would definitely recommend looking into these as an option for pain relief. It also helps repair the joints and stop the degeneration in it, and doesn't cause acute liver failure. Lastly is serrapeptase. Serrapeptase is actually derived from a bacteria in the intestines of the silkworm. So the serrapeptase, what it does is it actually combines with the globulins in our blood cells so that the body doesn't recognize it as foreign. And then in this case, it's actually a good thing because it goes to the sites where it needs to be. So it combines with the blood cell, and then it's attracted to the points where there's inflammation in the body, and it breaks it down. So this will actually break down dead proteins or fibrins in the body that aren't supposed to be there. So when you have arthritis, you have those startups in the joints that are excessive, that aren't supposed to be there. So serrapeptase will actually break it down, and it'll also eat up the enzyme that causes pain in the body. So not only does it lower inflammation and take out fluid in the body, it'll actually help take away the pain as well. So all 3 of these, the boswellia and the turmeric, are good for the chondrocytes, and the serrapeptase will take away the pain. Actually, all of them will help with that. Definitely would recommend looking into them, and I thank you for taking your time to talk to me today or listen to me today, and we'll see you tomorrow. Bye!